Hello, everyone. Hello and welcome. This is Hallie Cloud, and we want to welcome you to Health Reform Beyond the Basics. Beyond the Basics is a project of the Center on Budget and Policy Priorities. It is designed to provide training and resources to facilitate enrollment in the health insurance marketplace and Medicaid. We provide these resources for healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. The Center on Budget and Policy Priorities is a nonprofit policy organization, and it is not a part of the U.S. Department of Health and Human Services. This webinar series is also not intended for press purposes. As always, after the webinar, we'll circulate the slides, a video recording of the presentation, and additional resources. We're also going to post everything to our Beyond the Basics website at healthreformbeyondthebasics.org. I'll also put a copy of the slides in the chat in just a moment. So you'll have a PDF of that as well for the presentation today. Next slide, please. All of you are muted and in listen-only mode. If you'd like to ask a question, please click on the Q&A icon in the control panel at the bottom of your webinar screen and type your question into that little box. We'll be monitoring questions throughout the webinar, and we'll pause for Q&A a couple of times. We're definitely not going to be able to answer every question asked, but we will have a record of all of your questions and can use them as guides for future resources and presentations. You can also email questions during or after the webinar to beyondthebasics@cbpp.org. And you see that email on your screen too. Next slide, please. Today, this is part 2 in our Open Enrollment 10 series. We're going to provide an in-depth review of eligibility rules for the premium tax credit, including how offers of employer-sponsored insurance can affect eligibility. And we'll also go over how the premium tax credits are calculated. Today, our presenter is Jenny Sullivan, who is the Director of Health Coverage Access for the Center on Budget and Policy Priorities. And with that, I will pass it along to Jenny. Welcome again.
Great. Thank you so much, Hallie, and welcome everybody. So premium tax credits are really a central concept to your work, so we always dig into these in a lot of detail on this webinar. Just a note, same thing that I mentioned last week, but the application does a lot of the heavy lifting. Nobody is going to ask you to get out your pencil and calculate someone's premium tax credit and take that to the bank. But it's still important to understand how people get the results they do and why people are eligible for the assistance they are. So we'll talk about PTC eligibility requirements, how it's calculated, and how it's reconciled. The other thing I'll mention is that although our screenshots all come from the healthcare.gov application, the policy concepts are broadly applicable in all states. Now, some of the idiosyncrasies of healthcare.gov may not be replicated in state-based marketplaces, but if you have questions, feel free to ask us online and we can look into things for you. So what you're looking at here is, just to get our bearings, what the coverage landscape looks like for 2023. So if you're eligible for Medicaid, you can't get a premium tax credit. You can see Medicaid eligibility in the dark blue here, with adults eligible with income up to 138% of the federal poverty level in expansion states, but of course, very low or zero for adults in non-expansion states, depending on whether they're parents of dependent children or not. The light blue, which covers the whole rest of the landscape, is potentially PTC eligible folks. Now, in the past, this chart ended at 400% of the federal poverty level, but since 2021, eligibility for tax credits has not been capped at 400%. Now, people are eligible on an income basis as long as their income is at or above 100% of the federal poverty level. Now, they have to meet other eligibility requirements as well, of course, but in terms of income, it can be anything above 100%. So let's get into those details a little more. So to start with, I've already used the acronym once without defining it, but I will say PTC throughout today's webinar and occasionally APTC for Advanced Premium Tax Credit. But a premium tax credit means the income-based financial assistance for eligible people who purchase coverage in the health insurance marketplaces. Now, you can take your APTC in advance, which is what almost all people do. And that means the credit is sent to insurers, and then the enrollee pays the rest of the premium every month. Then at tax time the following year, the reconciliation process happens. If somebody gets too much credit in advance, they might have to repay some amount, or if they didn't get all of the credit they were ultimately qualified for, then they can collect the rest at tax time, either as a payment to them or to reduce their overall tax liability. The other option that people can choose to do is to wait to take the full credit at tax time. Now, practically speaking, very few people do this because the whole purpose of the tax credit is to make health insurance more affordable and allow people to buy it throughout the year. But some people have this option and they can slide the scale anywhere between these. They can choose to take a part or all of the credit in advance or wait to take it all at tax time. If they take it all at tax time, that means they're paying the full premium every month of the year for the whole coverage year, which is just not practical or affordable for most people. I will use the terms PTC and APTC relatively interchangeably, but if you have questions, feel free to ask. Okay, so here are the general APTC eligibility requirements. There are three main requirements: income, having an eligible filing status, and not being eligible for other minimum essential coverage, or MEC. So income has to be at or above the poverty line. As I mentioned, we used to have this 400% of poverty cutoff, but because of the American Rescue Plan Act, people can qualify for help regardless of income, as long as it's at or above 100% of poverty. Now, of course, everyone is not eligible for a PTC, but depending on their age, their expected contribution, and the cost of the plans where they live, they might qualify at higher income levels. Removing the upper income limit for PTC eligibility has been especially helpful for people who live in high-cost states, people who are older, and people who have very high incomes. There are, of course, some exceptions to this, which we will discuss. The second requirement, eligible filing status, is that somebody, and we talked a lot about this at our webinar last week, must file single, or if they're married, file jointly. And you can't be a tax dependent yourself. If you are a tax dependent, then whomever is claiming you has to apply for the PTC on your behalf. There's some exceptions there as well, which we will discuss. And then finally, the third requirement is that you have to be ineligible for another form of minimum essential coverage. Now, in addition, to enroll in a marketplace plan, even without a premium tax credit, you have to be a US citizen or have lawfully present immigration status. And you cannot be incarcerated unless that's pending disposition of charges. And you have to live in the service area where you buy your marketplace plan. So even if you're going to buy a full cost plan with no financial help whatsoever, you have to meet those three requirements in the yellow box. So now let's talk more about the specific income requirements. So I said earlier that the requirement is that household income be at or above the poverty line, but there are some exceptions. And these are for people who are lawfully present immigrants if they're not eligible for Medicaid because of their immigration status. Medicaid eligibility rules vary by state, but if the person doesn't meet the requirements in their state, but does have a lawfully present status, then they can qualify for PTCs even with income below the poverty line. And this is true regardless of whether a state has expanded Medicaid. Additionally, there's a reconciliation safe harbor that comes into play at tax filing time. So if someone had projected their income to be at or above 100% of the federal poverty level when they applied, but they're ultimately found to have a lower income at the end of the year when they reconcile, they're still eligible for the PTC. And this safe harbor prevents people who have very low incomes from having a repayment obligation when it comes time to file their taxes. We get asked about this a lot, so happy to revisit it if folks have other questions. So you can see income for households of different sizes and what that equates to in terms of a percentage of the federal poverty line. And although the dollar amounts can get higher and family size can certainly be larger than 4, it doesn't automatically mean a person will qualify. It depends on the cost of plans in their area relative to their income. Remember, eligibility for PTCs is based on the federal poverty guidelines in place as of the start of open enrollment. So for this upcoming 2023 coverage year, we're basing those decisions on the 2022 federal poverty guidelines. And all of that, we have updated our 2-pager sort of handy desk reference guide, and that is a link at the very end of this slide deck, and also you can find it on our website. It's probably the most downloaded resource we create. Okay, so let's move on to the second requirement for PTC eligibility. You also have to have an eligible tax filing status. And we did talk about this in greater detail last week. You can't be a dependent of another taxpayer, as I mentioned before, and you have to file jointly if you're married. But of course, there are exceptions, and we'll go through those now. You can, number one, be head of household, or if you are a survivor of domestic abuse or an abandoned spouse who is technically married but not filing jointly with your spouse, you can still qualify. So the latter two, people would be able to select single as their filing status when applying for APTCs, even though that may not be the reality of their life. And that is absolutely allowed. The marketplace is not going to require additional documentation to verify that someone is eligible for these exceptions. They are an attestation, and that is all. So the head of household exception is built into the questions on healthcare.gov, and we'll talk a little bit more about the qualifications for that bucket in a moment, but you don't have to know anything special to get that tax filing status. It will ask you the questions in the application and and proceed accordingly. For survivors of domestic abuse and abandoned spouses, what you need to know is that these folks can claim single tax filing status. And sometimes we call this a workaround, but that might be overthinking it a little bit. It's not something that you have to call the call center to access or any other special paperwork or verification that you need to do this. You just need to know to click that radio button to the person is single. So we have a healthcare.gov screenshot here to show what the questions look like, but the requirements are true in every state, regardless of whether it's a state-based marketplace or healthcare.gov state. So to get at filing status, the application will ask if the person will file a joint return with their spouse after they've said that they're married. And you'll see the text there, which in the blue, which can be helpful to read, because in this case, it sort of prompts you to not say no if you think that she might be eligible for some of these exceptions, because if she says no, she's not going to file a joint return and she is married, then she's not going to be able to get PTCs. So pay attention to these blue boxes because they're there to draw your attention. And at the end of the application, if you don't pay attention to those, you might not, your client might not ultimately be eligible for PTCs that they should qualify for if these questions aren't answered appropriately. Okay. So looking more closely at these exceptions, who can file as head of household? These are typically single people with dependent children, and it's generally straightforward because when these people are asked if they're married, they say no. But in some cases, a married person might be separated from their spouse or have children living at home. And we want to get away from that married filing separately status because they won't qualify for PTCs. But if they meet the criteria for head of household, they could qualify. So these are the questions the IRS asks to determine if a married person can file as head of household. You have to be able to answer yes to all of them. So that you file taxes separately from your spouse, that you live apart or lived apart from your spouse for at least half the year, you pay more than half of the cost of keeping up your home, that your home is the main home of your child or other dependents, and that you're eligible to claim them as a dependent. So let's talk a little bit more about the other exceptions to the joint filing requirement. You can see here that a person can claim to be single even if they are actually married filing separately, if they're a survivor of domestic abuse or an abandoned spouse. These people are eligible for premium tax credits, but they have to select single as their filing status. If they answered married filing separately, they wouldn't qualify for PTCs. Somebody who is a survivor of domestic abuse is somebody who's living apart from their spouse and unable to file a joint return because of the abusive situation. An abandoned spouse is someone who's living apart from their spouse and cannot locate their spouse after reasonable diligence to find them. And these have to be, answered in good faith, but they don't require verification. They're only available for 3 consecutive years. And as you can see on the left-hand side of the screen circled in red, the help text for the application also helps to point you in the right direction. So in case somebody says, well, I just said I'm completing this application under penalty of perjury and I am married, so I'm not comfortable saying single. You've got this help text here to help reinforce that these are in fact the appropriate rules. So there's a special rule for certain immigrants who file a form 1040-NR, that means non-resident. And for these people who are often students and don't meet the substantial presence test their first 5 years in the US, they aren't allowed to file jointly with a spouse. If they're married, they have to file married filing separately, which means they are not eligible for PTCs. There's no workaround for this. This is just an eligibility rule that makes certain people not eligible for PTCs. Okay, so we've talked about income and about filing status. Now the third bucket, the third major requirement for claiming APTCs is that the person can't be eligible for other minimum essential coverage. So there are a few types of MEC that would bar someone from getting premium tax credits if they're even eligible for that form of coverage, even if they're not enrolled. We've got most government-sponsored coverage like Medicare, Medicaid, CHIP, people terminated from Medicaid or CHIP, either for failure to pay premiums or terminated for failure to pay child support. These people are ineligible for PTCs. You could also have people who have an employer-sponsored offer of coverage that's affordable and meets minimum value. Even if they're not enrolled, if they have that offer, they are not eligible for PTCs. There are also some types of minimum essential coverage that only disqualify someone from PTC eligibility if they are in fact enrolled in them. And that includes COBRA, employer-sponsored retiree coverage, certain veterans and TRICARE coverage, and Medicare that requires payment of the Part A premium. So this is a smaller group of folks who are actually paying their premiums for Medicare because they didn't have enough working quarters to qualify for free Medicare. Okay, let's unpack that term MEC just a little bit more. The application is going to ask what kind of coverage a person has. And we've got a screenshot here of this laundry list of different kinds of health coverage. And you're going to have to look at these and make sure that the people that are applying for coverage don't already have any of these forms of coverage. And obviously this particular example is for Florida, but the options will look slightly different depending on the state. At the end, I just want to draw your attention to the last two check boxes because they can be very vague and hard to understand what this might mean. Other full benefit coverage or other limited benefit coverage. What do those terms mean? So these are referring most typically to government coverage, other forms of government coverage. If the coverage offers comprehensive benefits, then the person wouldn't qualify for PTCs because they've already got a source of comprehensive coverage. And this includes things like Medicare, Medicare Advantage, Medicaid and CHIP, TRICARE, et cetera. But if the coverage only offers limited benefits, then the person could qualify for PTCs because they don't have another form of comprehensive coverage. And this would include certain categories of Medicaid, like emergency Medicaid, Medicaid family planning categories, people with medically needy or spend down Medicaid, voluntary Medicare, again, that requires a premium, and AmeriCorps coverage. And yeah, we'll move on from there.
Okay, now we need to dig into employer-sponsored coverage in a lot more detail. And this is where things can start to get pretty complicated. I want to note right now that we have re-recorded this section in early November because a new federal rule came out after this webinar was originally recorded in September that changes how affordability of employer-sponsored coverage is calculated, which we'll get into in great detail in just a moment. So, in general, a person cannot get APTC if their employer-sponsored insurance, or ESI, meets three criteria. If it's in an eligible employer-sponsored plan, if it's considered affordable, and if it's considered comprehensive. Now, to be an eligible plan, it can't be indemnity or accident coverage. It must be a full health insurance plan. To be affordable, it can be up to 9.12% of household income in 2023. If it exceeds 9.12% of household income, then it's considered unaffordable. And that percentage changes every year. And third, to be comprehensive, it must meet the minimum value standard, which we'll get into. If a person has an offer of ESI, but it doesn't meet one or more of these requirements, then the person may be eligible for PTCs. To determine if an employer offer meets these requirements, the marketplace application will ask some questions about how much someone pays for their coverage and what their offer is. It's important to know what we're looking at here. So for low-wage workers, it can get tricky when they're offered accident coverage that's very cheap or free, as well as comprehensive coverage. When the applicant is asked to enter the premium for their offer, it's also important to exclude plans that are not comprehensive, like accident coverage or single disease coverage. You can recognize this kind of indemnity coverage because it has a specific limit per day or per episode, like $100 a day for hospital coverage, for example, which you wouldn't find in a comprehensive plan. So once we've determined that a plan counts as full coverage, we need to get into affordability. So coverage is considered affordable for the employee if the employee contribution for self-only coverage is up to 9.12% of household income. Again, that's a 2023 figure. If the offer of self-only employer coverage exceeds that threshold, it's considered unaffordable, and the employee can qualify for PTC, assuming they're otherwise eligible. Now, previously, affordability for a spouse and dependents used the same affordability test as is used for the employee. But the final Treasury regulation issued in October 2022 changes the affordability test for the spouse and dependents of an employee, beginning with the 2023 coverage year. Starting next year, or for determinations of coverage for next year, an offer of employer coverage is considered affordable for the spouse and dependents if the employee contribution for family coverage that covers the employee, the spouse, and dependents is up to 9.12% of household income. If the offer of family coverage exceeds that threshold, it's considered unaffordable, and the spouse and dependents can qualify for PTC, assuming they're otherwise eligible. Now, as in years past, the application will ask the appropriate questions and conduct the affordability calculation. So you don't need to do this math yourself, nor would a consumer applying for coverage. You can see a screenshot here, though, on the right-hand side of the new application question. It simply asks how much the employee would pay for the lowest cost plan that would cover everyone in the tax filer's household. The employer coverage tool available on healthcare.gov has also been updated to ask people about the cost of employer coverage for the spouse and dependents. Now, this change may help a lot more people qualify for PTCs who were previously locked out. However, as you're assisting these households, it's important to help them figure out their entire monthly premium as they work their way through this process. An employer offer could be affordable for the employee, but not for the spouse and dependents. This would mean that the spouse and dependents could qualify for a PTC, but the employee would not. So as you can see from the visual on the slide, which is just an example, this is not what would be the case for every household. It would vary from every one household to the next. But as you can see in this example, the family could choose to split their coverage between the affordable employer offer and marketplace coverage with PTC, or the employee could pay for full cost marketplace coverage and the spouse and dependents could stay in marketplace coverage with PTC, or the whole family could enroll in employer coverage. Now, the last option is likely to be the most expensive, so considering options where PTC is on the table will certainly be worth considering, but this is just to illustrate how important it is to really get into the details of what's being offered to a household so that they can make the best decision for their needs. Now remember, families will have separate premiums, deductibles, and out-of-pocket maximums for each plan they're enrolled in, and those costs can add up. So assisters are also going to want to pay attention to this and help people understand how from month to month, both their premiums and the cost of getting care will add up over time. So we've talked about the type of coverage offered and affordability. Now we need to talk about minimum value. What does it mean for an offer to meet the minimum value test? So an ESI plan meets minimum value if it has an actuarial value greater than 60%. And this is not 60% related to coinsurance or other obvious characteristics of a plan that you can easily assess. You really need to look at the summary of benefits and coverage document. All plans are required to provide a summary of benefits and coverage, and it's a 4 to 5 page standardized document that includes a question that insurers are required to answer about actuarial value. You can see that question on the screen there. Does this plan meet the minimum value standard? The application will ask a simple yes and no question about whether the employer offer meets the minimum value standard, but as a general rule of thumb, employer coverage does meet the minimum value standard. So it would be very rare to have an employer offer that was below a 60% actuarial value. So now let's go through a few examples to put these concepts together. In this first one, we have Monica and Roberto. They're married and have 2 kids. Their household income is $40,000. Monica's employer offers only one comprehensive coverage plan that meets the minimum value, and there are 2 enrollment options, one that would cover just her for $150 a month, or one that would cover the whole family for $450 a month. Now that second option in particular, $450 a month, feels pretty steep for Monica and Roberto, so they want to know if their family would qualify for APTCs, for marketplace coverage. So first, let's look at Monica. Is her plan affordable? Now remember, we're always comparing the cost of coverage to the full household income, or MAGI, for the affordability test. So in this case, we're looking at Monica's income and her spouse Roberto's income. Her offer would cost $150 a month for just her, which is 4.5% of their household income. Therefore, Monica does have an affordable offer of employer coverage, so she's not eligible for PTCs. But what about her offer of family coverage through her employer? That would cost $450 a month, which is 13.5% of their household income. This exceeds the affordability threshold of 9.12% of income, so Roberto and the children do not have an affordable offer of employer-sponsored coverage. Therefore, they can qualify for PTC, assuming that they're otherwise eligible. And this is what's different going into the 2023 coverage year as compared to years past, when Roberto and the dependents and the children would not have been considered to have an unaffordable offer. Because Monica's offer was affordable just for her, their coverage would be considered affordable as well, even though the true cost to cover the whole family was quite high. So this is an important change that opens the door to PTC eligibility for spouses and dependents in a way that it hasn't been before. Now let's change this example up just a little bit. Let's say that Monica's employer offers coverage for the kids, but not for Monica's spouse. So the test for Monica is the same. She has an affordable offer, so she would not qualify for PTCs. But the employee plus dependents premium cost at $350 a month would cost 10.5% of their household income. So it exceeds the affordability threshold. That means the kids could qualify for PTC. Although in this case, given that their income is only $40,000 a year, they're probably eligible for Medicaid or CHIP. But in this case, because Roberto isn't even offered coverage through Monica's employer, there is no affordability test that you have to conduct for him. He's not offered coverage, and so he would be eligible for PTC, assuming he meets other eligibility criteria.
Okay, so let's just talk a little bit more about some additional rules and exceptions for employer coverage. Some coverage disqualifies someone for PTCs just if the offer is on the table. That's employer-sponsored coverage that meets affordability and minimum value standards, even if the person isn't enrolled. And this is true even if somebody misses the open enrollment period. They might say, well, they offered it, but I didn't enroll, and that was a long time ago. It doesn't matter. Technically, they are not eligible for PTCs in this case. Now, the one exception is for some employees, maybe there's a certain month waiting period before they're allowed to enroll in the employer plan. And during those months when they cannot enroll in the employer plan, they do qualify for APTCs, or they would, assuming they meet other eligibility requirements. On the other hand, there are some forms of employer-sponsored coverage that only disqualify you from PTC eligibility if you actually enroll in them. They can be out there, but they don't disqualify you unless you grab that coverage and enroll in it. And that includes employer-sponsored coverage that doesn't meet the affordability or minimum value standards. That includes COBRA coverage, retiree coverage, and student health plans. If the employer coverage is not affordable or minimum value, but the employee enrolls in it anyway, and let's Be honest, that might happen. People don't necessarily think about these questions when they're deciding whether or not to enroll in a plan. They can't get APTCs in those months, even though it's technically not as comprehensive or affordable as the standards dictate. They would have to drop the coverage to enroll in a marketplace plan with an APTC, but dropping the coverage during the year is not going to trigger a special enrollment period. So they would need to drop the coverage and enroll during the open enrollment period to get into the marketplace next time around. Okay, wanted to do just a quick example on COBRA. It's one of the forms of coverage where if you have an offer, having an offer alone doesn't disqualify you, but if you enroll in it, it does from PTCs. So just wanted to walk through one more example on this. Last month, we've got Serena who voluntarily left her job and lost her health insurance. She has an offer of COBRA, but of course, as COBRA so often is, the premium is very expensive. So if she chooses not to enroll in COBRA, then no problem. Assuming she meets other criteria, she can get a premium tax credit and she can enroll in the marketplace coverage during her loss of coverage special enrollment period or during the next open enrollment period. So she would have a 60-day period before or after she loses her employer coverage, and she would be able to enroll in the marketplace at that time. But if she does enroll in COBRA, then she's not eligible for PTCs. So during her 60-day SEP, after she loses coverage, if she enrolls in COBRA and drops it before the end of that 60 days, then she could still get into the marketplace, as long as she gets into the marketplace during that 60-day period. Otherwise, if she enrolls in COBRA, then she needs to wait until the next open enrollment period in order to enroll in marketplace coverage. And she can't voluntarily drop COBRA at any other time during the year and get PTCs. She has to wait for open enrollment. Okay, one more example here. We have Kayla. She's 24 years old. She's a single tax filer, and her income is $19,000 a year, which means it's below 150% of the federal poverty level. And she is considering a few different coverage options, which can sometimes be the case, especially for young adults. Her dad's employer offers coverage that she actually could join, even though she's a single tax filer independent of her parents, because she's under age 26. His offer doesn't bar her from getting PTCs, though, because they're not in the same tax filing household. That's because, although she's 24, because she's 24, she can't be claimed as a qualifying child, and her income is more than the minimum $4,400 a year, which means she can't be claimed as a qualifying relative either. She's not in his tax household, so she could enroll in that offer through his coverage, but she doesn't have to, and having it doesn't bar her from PTC eligibility. So she's also eligible to enroll if she chooses in a student coverage plan, or she could enroll in marketplace coverage. So those three options, and this is where you might need to help people really discern what their options are and what the ultimate impact might be on their wallet. And there are other factors to consider too, of course, but looking purely at the cost, we've got the offer of dad's employer coverage. Wouldn't cost her anything. It's just part of family coverage. Mom and dad are generous. The actuarial value is 90%. That's pretty generous. That's a pretty high, robust plan. Or we've got student coverage. Now that would cost her something. That would be $150 a month, but the actuarial value is only 70%. So it's not the most generous plan. Doesn't provide the best coverage. Or she could qualify for marketplace coverage. That would also cost her a $0 premium, because with an income below 150% of the federal poverty level, she would qualify for a very generous APTC. Her required or expected contribution is $0. And she qualifies for cost sharing reduction. So she'd qualify for a very high actuarial value plan, 94%, without having to pay anything. So those are, comparing that offer with the dad's offer, or the dad's employer's offer, would be something worth exploring. Now the networks might be different, there might be other considerations, but you really want to walk through all the different options, because it can get kind of complicated. One other thing to mention, because Kayla has an income below 150% of the federal poverty level, she would qualify for a special enrollment period at any time throughout the year, up to one time per month. Now, this is reflecting a recent policy change that took effect earlier this year, that allows people with income below 150% of poverty to qualify for that special enrollment period throughout the year. So if she missed open enrollment, she could still enroll in marketplace coverage later. Okay, one other thing, health reimbursement arrangements. These are employer-funded tax-free employee accounts for reimbursement of medical expenses. And there's two types of health reimbursement arrangements that interact with marketplace coverage: qualified small employer HRAs or QSARAs, and individual coverage HRAs or ICRAs. Both of these have affordability tests that measure the employer's contribution to the cost of a marketplace plan against the 9.12% affordability standard, but the tests are different. We have, healthcare.gov gets into a lot about how these work in the application if it applies, but it doesn't apply to most people. So you're going to want to just refer to the text in the application if this does happen to come up. We also get into this more in a separate webinar module on our website that we can send the link around to. That's a pre-recorded module from a little while ago. And then the resource at the bottom of this slide also gets into some details on how those affordability tests work for those very specific forms of coverage. Okay. There's a few special rules related to overlapping coverage. These are generally applied at reconciliation, but they can be good to know up front. So people are eligible for premium tax credits or people who are eligible for premium tax credits on the first day of the month are considered eligible for the full month. So even if they have a change in circumstances, they become eligible for employer-based coverage, they are still counted as eligible for PTCs for the duration of the month. We don't prorate or split it any smaller than that. If a person's eligible for premium tax credits, but later becomes eligible for Medicaid, maybe their income goes down, their household size goes up, the premium tax credit is allowed for any months of retroactive Medicaid coverage, so they can actually overlap if that applies. And the person can choose to remain in PTC coverage for the entire calendar year, or they can enroll in Medicaid. There's not a penalty there for that first year. Now, when they go to redetermine, they would need to move to Medicaid. And then for Medicare, people lose premium tax credit eligibility the first day of the month following the month they sign up for Medicare Part A. So if the person doesn't enroll in premium-free Medicare Part A right away, they're considered Medicare eligible as of the first day of the first full month after the person's initial Medicare enrollment period ends, and they lose PTC eligibility beginning on that day. Because remember, even being eligible for Medicare Part A disqualifies a person from APTC eligibility, even if they don't enroll. That's people typically enroll, but even being eligible disqualifies you. But they do need to report this change. Otherwise, they could continue to receive APTCs and then owe money back at tax time. And there are also some important considerations that we won't get into now, but that apply if somebody becomes Medicare eligible, just to make sure that the rest of the family, if they remain PTC eligible, that you go through a fairly deliberate process to make sure that nobody loses coverage when one person from the family sort of exits for Medicare coverage. Okay, finally, if the marketplace made a mistake, somebody reported a form of employer coverage that should have disqualified them PTCs, but the marketplace gave them PTCs anyway, then they're fine. The safe harbor doesn't apply when the person re-enrolls, however. At that point, things need to come clean in the wash. We need to put forward that they have a qualified ESI offer, and they would probably have to enroll. They wouldn't be eligible for PTCs. Okay, at this point, I'm going to go ahead and pause for questions, and but not for too long because we have more content to cover. Hallie, anything rising to the top?
Yeah, we just have we'll do a couple really quick questions. So there are a couple questions on minimum value for employer-sponsored coverage, and there was a question asking if someone is offered employer coverage that only covers work-related injuries, would that be considered minimum value? And a similar question if an employer plan only pays for preventative or wellness care benefits, do any of those kinds of coverage count as minimum value for the employer-sponsored coverage sort of test?
No, those would not be considered full coverage.
Perfect. One other question that you mentioned, but I want to reiterate is when you're looking at household income, does that include both the employee and the spouse?
Correct. The household income, assuming that they file taxes together, we're going to look at the tax filer household. In most cases, they're going to be filing together. And if we're, again, looking for PTC eligibility, then hopefully these are a married couple who are filing jointly, but that means that we would be looking at their income and potentially dependents' income as well, although there are, the application will account for whether that needs to be considered or not.
Perfect. And then one last question for the exceptions to the married filing separately uh, requirement for PTCs. If someone either is in a situation where they have domestic violence or are an abandoned spouse and can claim that that they're single on the application, that is for 3 consecutive years, correct?
Correct. Yep, that's absolutely right.
Perfect. And then we will answer more questions at the end. So keep typing them into the box. Again, we're not going to be able to answer everyone's questions, but if you really need something answered, you can email us at beyondthebasics@cbpp.org, and we'll also have a record of all these. So take it away.
Perfect. Okay, so sharpen your pencils, get out your calculators. This is where the math part of this all comes in. We're going to talk about how the PTC is calculated. And this honestly is my favorite part. So the PTC is equal to the cost of the benchmark plan minus the expected premium contribution. So the benchmark plan is the second lowest cost silver plan available to each member of the household. And the expected contribution is what the household is expected to contribute toward the cost of premiums based on their household income. So it's a percentage of their income. The higher your income, the larger proportion you're expected to contribute. And the scale currently ranges from 0 for very low income folks up to 8.5% of income. So how much will a household pay? Here you can see how much a family at various income levels will pay in 2023 compared to what they would have paid without the premium enhancements that started under the American Rescue Plan Act. Congress recently extended these enhancements for an additional 3 years in the Inflation Reduction Act. So as a result, premiums are much lower for everyone, and premiums continue for people with income greater than 400% of the federal poverty level. It's also worth noting here that the special enrollment period for people with incomes below 150% of the federal poverty level, that will continue as well, as long as these enhanced PTCs continue. The linkage is a little more complicated than I'll get into today, but that's the shorthand. We will continue to have this SEP through the 2025 coverage year. It's worth noting that this 8.5% of income, or whatever the cap is for a particular or expected contribution is for someone in a particular income, this isn't the maximum that they could ever pay. This is just what they would pay if they enrolled in a benchmark plan. We'll talk more about how things fluctuate based on plan choice. And then here's one more visual. If you prefer a table to a graph, you can see that people with income less than 150% of poverty can get a benchmark plan for a $0 premium. So their PTC is equal to the full cost of the premium for the second lowest cost silver plan, which is what a benchmark plan is, the second lowest cost silver plan. Plans are divided by metal tiers. Platinum is the most generous, but it has the highest premiums. And then bronze is the least generous, excluding catastrophic, which is even less generous. But bronze is the least generous, widely available plan, but it has the lowest premiums. The benchmark premium, or the benchmark plan rather, is between these extremes. So it's a decent plan, not the very best, but pretty good. And the benchmark plan will be different in each rating area. It's not a national standard. It's something that varies based on a few things. So there are 3 main factors that affect the cost of the benchmark plan for somebody: their age, their family size, and their geographic area that they live in. So someone who's older can't be required to pay more than 3 times the premium of a younger person. And each family member is rated separately. Family size is the next criteria. Total premium for the family is the sum of individual premiums for the family members. So it's not like you have sort of a single family plan rate like you would in employer-sponsored coverage, for example. you add up the individual premiums of everyone in the household to get the total cost. And in families with more than 3 family members who are under the age of 21, then you just count the 3 oldest children. Finally, the benchmark plan is affected by the geographic area because, like all things, prices vary by location. So there are a couple other factors that affect the premium that someone pays, although not the cost of the benchmark plan. This is tobacco use and then the plan that the consumer chooses. So for tobacco rating, the application will ask if the applicant uses tobacco. If you use tobacco, it raises your premiums, although it can't be more than a 1.5 to 1 ratio. But the difference is not accounted for in the premium tax credit. It doesn't grow if your premium is higher because you use tobacco. People who use tobacco would pay the full difference between the premium and the tobacco rated premium out of their own pocket. This is subject to state option, and so far there are 7 states that have outlawed tobacco surcharges, so you won't see this everywhere. Secondly, perhaps most obviously, premiums are also going to vary depending on what plan a consumer chooses. So you take your PTC amount and you can use it to buy any plan on the marketplace. You're not limited to the benchmark plan. So I like to think of it as the enrollee's purchasing power on the marketplace. They get their PTC amount and then they can go and shop and get any plan that they want. They can enroll in the benchmark plan and it will cost their required contribution, but they can get a less generous plan and save some money, or maybe they need more generous coverage and so they're going to pay a little more out of pocket, but that APTC travels with them. So let's look at an example. We've got Teresa, Antonio, Gabby, and Michael, and their income is $55,000 a year, so 200% of the federal poverty level. And at that income level, their expected contribution is 2% of income, or $93 a month. So we've got 3 silver plans in their area that would cover the family. You can see the 3 prices there. The second lowest cost silver plan is the benchmark plan for them. So to determine what their PTC would be, we are going to take that $875 a month benchmark plan cost, take away the family contribution of $93 a month, and the difference, $782, is their tax credit that they can then take to shop for whatever plan they want. Taking a slightly different example, same family, same income, but let's say the kids are eligible for CHIP, which is going to be true almost in virtually every state with an income at 200% of the federal poverty level. In that case, we're only looking at the cost of, for the benchmark plan, we're only looking at the cost of coverage for 2 adults. So you can see that the benchmark or the plan premiums are lower. So the second lowest cost one, that's $7,500 a year, that's our benchmark plan for Teresa and Antonio. So our APTC calculation is that $625 premium minus the same family contribution, that same $93 that they would have had to pay as a family of 4, and then we get the $532 APTC. So what you can see is whether we've got a family of 4 or a family or 2 people in that family of 4 who are purchasing coverage, the expected family contribution is the same. The APTC modulates to account for the difference between the benchmark plan and their required contribution, or their required contribution. Okay, so now we want to look at the impact of income on APTC calculations. So we'll look at John. He's 24, and a benchmark plan in his area is $350 a month. So with his income at where it is, and he's just a single filer, his expected contribution is $45 a month. So his APTC is going to be $305 a month, the benchmark plan minus his expected contribution. But let's say his income is a little higher. If it goes up to 250% of the federal poverty level, then that premium tax credit is going to be a little smaller. The benchmark plan cost remains the same, but his expected contribution is 4% rather than 2%. So if you look at the graph, we can see that when his income increases from 200% to 250% of poverty, his expected contribution is going to go up accordingly, and his PTC will make up the difference, but the cost of the benchmark plan stays the same. Now let's look at what age does to PTC calculation. We'll stick with John, and we'll say his income is 200% of the federal poverty level, so his expected contribution is 2% of his income. But when he's 24, a benchmark plan costs $3,700 a year. So we've got an APTC of $263 a month, excuse me. If he were 64 years old, however, coverage benchmark plans are going to be much more expensive. The benchmark plan cost in his area would be $11,000, much higher. So his APTC would be much bigger because we take the difference between that and his expected contribution. You can see 24-year-old John pays the same amount for the expected contribution as 64-year-old John, but the APTC that they can take to shop for plans on the marketplace is very different. Coverage is more expensive when people get older, and so their APTC is more generous to help them with that cost. Okay, let's see. So this is another way to show that once the PTC amount is established, it can be used toward any plan on the marketplace. So in this example, the PTC covers more than half of the premium for the benchmark plan. But if John decides to enroll in the lowest cost silver plan or a bronze plan, then the PTC covers a larger proportion of premiums. If, however, he chooses a gold plan, it's going to be much more generous coverage, but the PTC isn't going to go as far. It's going to cover only about half of his monthly premium. Now remember, if people choose a plan with a monthly premium that's less than their PTC amount, they don't get to pocket the difference. So this is not savings that they will see. They can bring their premium all the way down to zero if their APTC is big enough, but they don't get to pocket the extra money. You're going to want to join us the next couple of Thursdays for our plan design and plan selection strategies webinars, because we'll talk more about how to help people understand how to use their PTC to shop for a plan and how to compare options. Okay, here's how the PTC amount appears on healthcare.gov when you're shopping for plans. You've gotten the eligibility determination, you're now looking at your plans, and here's one example plan. The big number that you'll see there is the monthly cost to the consumer. And then we've got the tax credit amount there. So sometimes you call that the discount amount, depending on how you want to talk about this with somebody. And then that very last number there in italics, that's the total premium. So just a quick decoder on the kinds of things that you will see if you're in, at least if you're in a healthcare.gov state. Okay, we're coming into the home stretch here, but want to emphasize now, and we'll talk about this more in the re-enrollment redetermination webinar, but it is really important to report changes throughout the year. This could be a change in income, household size, or home address. If somebody earns more than they projected when they applied for premium tax credits, they could owe more money back on they could owe some money back on their tax return if they don't report the change. If they earn less than projected, then updating their income throughout the year can increase their PTC and help them pay their premiums. Or it might even mean that they're eligible for Medicaid or CHIP, which would be free or very low cost. So if they don't report changes that would have resulted in a higher PTC, they will still get those back at tax time. But again, the whole purpose of the PTC is to help people afford and keep coverage throughout the year. And if their income has gone down, it's going to be harder for them to pay their premium if they don't get their PTC adjusted. Now, just a little example here to be aware of the way that healthcare.gov calculates PTCs. And I don't know if this is true in state-based marketplaces, but again, we can look into that if you're curious. Healthcare.gov calculates the premium tax credit divided by 12, regardless of when the change is reported. So like in this example, Malcolm's PTC is $2,400 or a year, $200 a month. But by September, he has an income increase and he reports that after he's already received 9 months of APTCs. So he's received $1,800 in PTCs. Based on his new income, he's only eligible for $1,200 for the whole year. So he's already gotten way more than that, and it's not even the end of the year yet. Unfortunately, healthcare.gov will calculate the APTC of $100 a month starting at when he reports that change. And if he accepts that, then he'll continue to get more credit or more PTCs than he will ultimately be eligible for. So in this case, what you should do is help him reduce the amount of PTCs he receives to zero. Again, there's that sliding scale where you can choose whether you're getting anything in advance or waiting until tax time to reconcile, because he's already received more than he's entitled to. And if he keeps taking more, then he's going to have to pay it back at tax time, which is never a fun situation. But talking a little bit more about those repayment caps, people who have more income than they projected will owe back some or all of the PTCs they received. And you can see the repayment limits here for tax year 2022. You'll notice that the limit for married and head of household tax filers is double the cap for single filers. And note at the bottom, we have the repayment limits for someone with income over 400% of poverty. People in this situation are responsible for paying back the full amount of the premium if their income is greater than 400% of poverty. And there is no cap. But now that PTCs are available for people at any income above 100% of poverty, this small change actually significantly can impact repayment requirements. So we're going to look at a quick example here. So we've got Malcolm, again, different Malcolm. For 2023, he projects his income will be $53,000 a year, so below 400%. And he gets a $7,500 APTC. But at the end of next year, his annual household income is actually $58,000. So it's gone up, it's higher than he projected. And based on that income, he's actually eligible for APTC of only $6,800. Now, in the past, before we had PTCs for anyone over 400%, his repayment amount would be would be the full PTC, it'd be $7,500 because he would be responsible to pay back the full amount between what he received and what he was eligible for, which is the whole PTC. He wouldn't have been eligible for anything. But now, because there are premium and tax credit enhancements that go up above 400%, he's only responsible to pay back the difference between what he received and then the $6,800 credit he was ultimately eligible for, meaning his repayment amount was only $700. Still, not a small amount of money, but significantly better than having to repay the full PTC. So that is the end of our tour de force and PTCs today. And we've got a bunch of links here. You have the link to the slides in the chat, and you'll be able to access these on our website as well. You can't click on the screen in Zoom and get to these links, but they're at your fingertips, I promise, or they will be soon. But we have lots of resources to support your questions and back up some of the things we talked about today. But with that, I'm going to take a little sip of water and ask Hallie if we have any questions.
Yeah, we definitely have a ton of questions. Again, we're not going to get to all of them, but you are welcome to email us at beyondthebasics@cbpp.org if nothing gets answered. We also have upcoming webinars, which were just on the screen. Thank you. That go into a lot of detail on some of the plan design, how to help people select a plan, immigrant eligibility, and then the ever fun data matching and consistencies. But a couple quick questions before we wrap up today. One question is, what happens if someone enrolls with APTC during open enrollment or whenever, but then at tax time they find out they're eligible for Medicaid? What happens then?
Sure. So there is a special safe harbor for people who are getting APTCs, but then who at tax time turns out that their income is below 100%. As long as the marketplace estimated at the time the person enrolled that their income would be at least 100% of poverty and they were otherwise eligible, then they don't have to pay that money back. So if income drops below 100%, they are safe. They do not have a repayment requirement.
Excellent. And then for the repayment requirements, if someone ends up below 100% of the poverty line, this is a clarifying question, they would still just have to pay, if they're a single tax filer, that $325 repayment cap. They don't have to repay the entire thing because they were below 100% of the poverty line, correct?
Correct.
Okay, perfect. And then someone had a question about where a navigator can find information on the benchmark plan for a zip code in their area. And we're going to have a whole webinar on plan selection strategies where we'll go into how you can find benchmark plans and compare them and really get to know the marketplace in your area. So that's a plug for our upcoming webinars. So that will have a lot of resources for you all to use. So stay tuned for that.
And I'll mention, Hallie, that for whoever was curious about that, most marketplaces, including healthcare.gov, in early October post the plans that are going to be available in the upcoming open enrollment period for the coming year. And you'll be able to start exploring those and looking at your options. And we actually have a resource on our website that from our webinar last month in August on plan selection strategies that gives you the link for the shopping tool in both for healthcare.gov and all the state-based marketplaces. It can be sometimes hard to find, but if you can get to that shopping tool, then you can explore what's available without having to fill out a full application.
Excellent. And we're at the hour, so I don't want to keep you guys too long. So I just want to thank everyone for coming today. Thank you for your wonderful questions. We will be posting a recording of this webinar and the slides to this webinar, as well as all of the resources that were sort of linked within it. We'll be posting all of that to our Beyond the Basics website at healthreformbeyondthebasics.org. It should be up by hopefully tomorrow, and we'll also send it around to all of you guys. There's a link in the chat that goes straight to the slides, so you'll have those now if you want to review things right away. You can find additional resources on our website. We always encourage people to go there. There's just a wealth of information on there. And again, if you have any additional questions, need assistance, please email our Beyond the Basics contact email at beyondthebasics@cbpp.org. And then with that, I think we'll bring this to a close. And thank you so much again, everyone. And we hope to see you next week for our webinars on Tuesday and Thursday. Thank you so much, everyone.